Okay, so thank you all for coming, and thank you, Matt, for introducing it. I would like to now extend a warm welcome to our guest speaker, Dr. Peter Willatts, or as I like to call him, Dad. Growing up with a child psychologist as a parent was certainly interesting. I can remember doing a lot of IQ tests, and when I was a wee girl, being woken up just after my mum had got me to sleep, so he could test my reaching skills, which I'm sure he'll demonstrate. But I don't think I turned out so bad. My poor dad thought he was coming over for a restful holiday and enjoying the delights of Melbourne in the winter and Christmas in July. This is a new concept to them. However, I did what any expert recruiter would do. I found him a job and put him to work. When people first heard my dad was speaking, they were excited, although there was some concern. People were worried, would they be able to understand him? Luckily, my sister and I are the only ones with funny accents. So even though I know it's very early in the morning, and thank you again for all coming, I'm sure you'll be able to understand him and enjoy this presentation. And here's some important stuff about Peter. Peter Willatts is a child psychologist at the University of Dundee. He's an international expert on the effects of nutrition and mental development of infants and children. His research has provided some of the most first evidence in the long-chain polyunsaturated fats in infancy and the key role that they play in developmental mental abilities such as planning, working memory, and intention. In following up studies, he's shown that the long-term benefits for health and mental abilities in later childhood. His latest research is studying the effects of providing iodine to very preterm infants with the aim of preventing impairment and to brain development. Peter Willatts has given invited talks on nutrition and child development in many international meetings, and most recently in China, Mexico, Brazil, Spain, and Malaysia. For several years, he's been a consultant for the European Food Safety Authority, and was recently appointed the first psychologist member on the scientific panel for nutrition, dietetics, and allergies. Today we're talking about, can food really make children smarter and better behaved? It is well understood that nutrition plays a key role in the development of children's brains, but what is the best food and what effects does it have on children's development? Information for parents and health professionals is also confused, misleading, and it can be difficult to know what to do best. Do omega-3 fats really make children more intelligent? Will removing food additives help children with ADHD? Can providing adequate amounts of micronutrients reduce violent or aggressive behaviour? These are some of the topics that will be discussed in this review of scientific evidence, which separate fact from the fiction and provide useful advice on how diet can promote optimal development. Over to you, Dan.
Well, thanks, Joe. That certainly is the most unusual introduction I've had this year. It's another fine mess you've got me into. It's really nice to be here, enjoying your sunny, warm weather. Christmas in July, that was a novelty. We've embraced that. And I'd certainly like to thank McArthur for inviting me here to give me this opportunity to talk to you all about the importance of nutrition and the effects that nutrition has on development. Okay, good. So as you heard, I'm a psychologist, and my research looks at the development of children, particularly their mental cognitive development. One of the things I study is problem solving, and I've just solved a problem here, so we're doing okay. But for the last 20 years, I've been very interested in the role of nutrition and the effect this has on children's development. Now, if I was giving this talk 20 years ago, and I was talking about the factors that influence development, I'd be talking about genetics. Clearly genetics play an important role. And I've been talking about the role of the environment, the kind of stimulation children get, the kind of experiences that have an effect on development. But I wouldn't be talking about nutrition, because 20 years ago we really didn't consider nutrition as an important factor. You look at the textbooks from 20 years ago, there were no chapters on nutrition. Now, it's all changed. Today, we recognize that nutrition plays a key role in development, particularly early development. And we also know that nutrition can have long-term benefits for development. And I'm going to talk about some of the research that shows those effects today. So nutrition affects both the structure and the function of the central nervous system, particularly during critical periods of development. We know it affects what we call the macrostructure in the brain, all those large areas which are developing, such as the cerebellum at the back of the head for controlling movement and posture, hippocampus for controlling memory, and especially the frontal cortex. This is a really important area of the brain. It's the last area to develop. It develops throughout childhood, and I'm going to explain exactly what effects nutrition has on the development of this key area and how that affects children's behavior. We also know that nutrition affects the development of the microstructure of the brain. So nerve cells have growth cones which then grow into dendrites which then connect at the synapses, and nutrition plays a key role in that development. And nutrition also affects the function of the brain, central nervous system, particularly the speed at which information can be passed from one nerve cell to another. So it's playing a role throughout development and then later function. So the critical period of brain development is from roughly the end of pregnancy, the third trimester, around week 20, to 2 years of life. Brain growth is extremely rapid at that time, and nutrition, providing optimal nutrition, is essential during that period. We now know from a study published last year that the newborn brain increases by 64% in the first 3 months. That's incredibly rapid growth. And at 3 months, it's half adult brain size. And that has to be supported by optimal nutrition. So now, compared with 20 years ago, we have leading international neuroscientists like Elizabeth Isaacs recognizing the role of nutrition. And here's a quote: "Nutrition is crucial to the initial development of the central nervous system and then to its maintenance." So there are many nutrients that play a role. These are only some of them. We have the macronutrients that we consume in large quantities: proteins, carbohydrates, and fats, but also micronutrients, which are required in small amounts. Micronutrients such as iron, iodine, zinc, selenium, a whole range of vitamins, and long-chain polyunsaturated fats. All of these play a key role in early brain development and then later brain function. Now, I want to make one point right at the start. If children have a healthy diet, they will obtain sufficient amounts of all these nutrients: macronutrients, micronutrients. So, normal healthy diet, you have no worries. And if your child has a normal healthy diet, then you don't need to provide supplements. Everything should be okay. Nutrition will be optimal. But of course, we know this isn't always the case. And junk food diets are prevalent everywhere now. Even in China, in Japan, Southeast Asia, where the diet used to be extremely healthy, things are changing. So the problem we have is that many children may not be getting an adequate supply of essential nutrients. So we want to consider two things. Firstly, the effects of adding important nutrients when a child's diet is deficient. Can there be benefits? What are the benefits? What should we be adding? And two key nutrients are omega-3 fats, DHA, because of hexanoic acid, to give it the full name, EPA, eicosapentaenoic acid, and also a whole range of micronutrients such as iron, zinc, iodine, etc. These are often missing from children's diets, and we want to know what are the effects and what are the benefits of providing them. But also, with the modern diet that children are getting, there are a number of components, substances, which are possibly harmful. And amongst these are food colorings and preservatives. And so it might be beneficial to remove these, to make sure these are not there, if they are causing problems. And we'll look at some of the research in a moment to see exactly what problems might be. So to start with, I want to talk about a key micronutrient, long-chain polyunsaturated fatty acids. There are two of these that are key building blocks in the brain. DHA, docosahexaenoic acid, it's an omega-3 fatty acid, and the other is ARA, arachidonic acid, which is an omega-6 fatty acid. Now these two fats occur in very high levels in brain tissues. In fact, they're in all cells throughout the body, but we're going to focus on the effects on brain development and brain function. We know they contribute to the growth of nerve cells, particularly the connections between nerve cells, the synapses that are forming at a very rapid rate during the first 2 years of life. And we also know that they influence the operation of neurotransmitters. These are the chemicals that are involved in the communication between one nerve cell and another. So they play a key role in development and then the function of the brain. Now of the two, we know very little about the role of ARA, this omega-6 fat, in the brain. There's pretty well no research that I could tell you about which tells us of the importance of ARA. But we do know a lot about DHA. So I'm going to focus mostly on the effects of DHA. And we know DHA is important because 7% of all fats in the brain is DHA. That's an extremely high amount for just one component. And in some areas of the brain, it's even higher. So if you look in frontal cortex, it's this area in the front, it's twice that amount, 15%. Now that tells us that DHA has a key role in the development and function of frontal cortex and all the processes that frontal cortex controls. And these involve processes such as planning and thinking, working memory, keeping track of information while you're working on a problem, attention, so being able to sustain focused attention while you're working on something, ignoring distractions, being able to switch attention rapidly from one topic to another. All of these things that are crucial to young children when developing, especially when they get to school, all of these are controlled by frontal cortex. And frontal cortex also regulates emotional behavior, particularly impulse control. So if you want children to be able to control their behavior, then we're looking at development of frontal cortex. So DHA plays a role in brain development and it plays a role in the development of this area of the brain, frontal cortex. How do we get enough DHA? How do we make sure children get enough? Now as humans, we can't manufacture DHA in our bodies from scratch. But what we can do is convert another fat. It's a shorter molecule, it's an omega-3 molecule, and it's called alpha-linolenic acid, ALA. And ALA you can get from dark green leaf vegetables, and you can get it from plant oil. So canola oil contains quite high levels of ALA. But the problem is that we're inefficient at making DHA. We can't produce enough DHA to meet our needs, and children certainly can't, by converting ALA. So the alternative is to eat foods that provide DHA directly. The best source is fatty fish. Fish such as salmon, tuna, herring, all of these foods that children love to eat. So that's the best source. Omega-3 eggs. Farmers now are feeding chickens on an omega-3 rich diet, and the eggs contain high levels of DHA. And that certainly is a valuable source. You can get omega-3 supplements and, interestingly, grass-fed beef. So if you have cattle who are raised on grass, not being fed corn, then they contain the meat contains quite high levels of DHA. So these are the best sources. Now for babies, if we're looking at this rapid period of development, babies can obtain their DHA in only two ways. They can convert this shorter molecule, ALA, to DHA, but we know in babies it's very inefficient, even less efficient than in adults. So they need preformed DHA. During pregnancy, this comes from the mother, and it's passed across the placenta, actively transported to provide a sufficient amount to the developing infant brain. After the baby is born, mothers who are breastfeeding will provide DHA, because DHA is part of breast milk, and mothers who can't breastfeed or don't want to can give the baby a formula containing DHA. And now nearly all formulas come with DHA added as a result of the research that's been carried out on the effects on development. However, if we're considering development in pregnancy and the effects of breastfeeding, then the amount of DHA that babies are going to receive will depend very much on the amount of DHA in mother's diet. There is a huge variation. So if you look at the figure here, the lowest levels, this area here, of DHA in breast milk are found in North America. The highest levels here on the right are found in Japan and the Philippines. And the difference is all down to diet. It's because there's high levels of fish consumption in Japan and the Philippines, high levels of DHA in breast milk. In North America, very low levels of fish consumption, very low levels of DHA. Australia is here, and you can see just a little bit above North America. It's surprising for a country where a lot of people live near to the coast, but curiously there's not a huge amount of fish consumption which will increase or provide adequate amounts of DHA. The average level in breast milk is 0.32% of all fats in breast milk. It sounds a very small level, but that, it turns out, is adequate for the developing brain. And you can see many countries are below that level. So it's important to make sure that mothers, both during pregnancy and also breastfeeding, have a sufficient amount of DHA in their diet to provide a sufficient amount for the developing brain. So the risk is that children may be deficient in DHA. Low DHA in mother's diet can affect development of the fetus, it can affect development of the infant while being breastfed. Providing infant formula, which has very low levels of DHA, or maybe no DHA at all, could also result in a baby becoming DHA deficient. And of course we have toddlers and older children who probably are consuming very low levels of fatty fish. Certainly analysis, apart from China and Japan and Philippines, shows that fish consumption is low amongst this group of children. So the question we have is, if DHA occurs in such high levels in the brain, and a lot of children may not be getting sufficient amounts, does that affect development? And the answer is, yes, it does. And the research is very, very clear on this. Some of the early research showed differences between children who were breastfed and children who were fed artificial formula, which at the time of this research didn't contain any DHA. And the difference when the children were followed up in later childhood is about 5 IQ points. And immediately researchers thought it's something in breast milk which might be producing this difference, and DHA content is one obvious candidate. The trouble with this research is there could be lots of other reasons why you get a difference between children who are breastfed and children who are fed formula. It could be other substances in breast milk which are affecting development. It could be something like development of the immune system. So that the children who are breastfed, we certainly know, have better resistance to respiratory illness, fewer colds, coughs and colds, and fewer days off school. That could explain the difference in IQ and something like that. It could be the interaction between the mother and the baby while breastfeeding that's stimulating development. It could be the emotional bond between the mother and her child, which is also affecting development. Could be all these factors. We need to find other evidence to see whether DHA is actually playing a role. And the way you do that is to carry out what we call randomized controlled trials. And you do it like this. So we take a group of babies, and let's say we're going to give them formula. Half of them will have a formula with no DHA, and the other half will have a formula with DHA. And then each baby in the study, we just decide by tossing a coin which formula they get. But the researchers don't know which formula they've got. The mothers don't know. It's kept a secret until the end of the trial. So there's no bias in the study. The two groups, their background characteristics are exactly the same. The only difference is whether they have DHA or not. And then if we see differences in development, we know it must be down to DHA and nothing to do with any of these other possible factors. You can also do the same with mums who are breastfeeding or mums during pregnancy. We can give supplements to mothers, either containing DHA or no DHA, a placebo. We can look at the effects on development. And this is the gold standard. The results of these studies can tell us conclusively whether DHA has an effect on development. And so the studies I'm going to talk about all involve this design, this randomized control design. And one of the first studies, interestingly, is an Australian study. And babies were given a fish oil supplement, liquid fish oil, for the first 6 months. It contained quite a high level of DHA, 280 milligrams per day. And then they were followed up at 12 months of age, and the researchers recorded the number of gestures that the children were producing. And children at this age produce a whole range of gestures. You know, they point to things that they want you to bring to them. They wave bye-bye, they lift their hands up because they want to be picked up. It turned out that the babies who had the DHA produced more of these communicative gestures than the children who received the placebo. DHA was accelerating, improving the early development of communication. That's a really important result. Another study was a colleague of mine working in Italy, very large study, over 1,100 infants, given a small amount of liquid DHA every day, 20 milligrams for the first year, and the children who received the DHA produced their first word 3 weeks ahead of the group that received the placebo, the no DHA. So that is a really key milestone in development, and it's clear DHA is playing a role in the early development of communication. But another fascinating study, which was also carried out in Australia here, very large study, over 700 pregnant women were given a supplement of DHA or a placebo. So they're getting either 800 milligrams of DHA per day during pregnancy or no extra DHA. And then the children were followed up at 18 months. They were given a standard test of development. It's rather like an infant IQ test, but we talk about not IQ, but DQ, developmental quotient. A DQ of 100 is average, it's normal, and a DQ less than 85 is something to be worried about. It's delayed development, and you would be really concerned. You need to investigate and see what the problem is. The group whose mothers received DHA had a lower incidence of delayed development. So there were 3%, just over 3% of the children in that group showing delayed development, twice that number, 6.4%, in the group that didn't receive the DHA. That's a massive effect. That is a huge effect, and a very simple intervention during pregnancy, providing adequate amounts of DHA, can clearly reduce the incidence of developmental delay. It reduced it by more than 50%. That's a really important finding. But during the first year of life, in our research in Dundee, we've developed a test of problem solving, which has now been widely used in these studies, looking at the effects of DHA on development. And this is the problem. It's a two-step problem. Baby's sitting here at the table, and I've taken his toy and I've put it on the end of this cloth here, and then I've hidden it under a cover. So to get the toy back, he's got to do two things, two steps. He's got to pull the cloth so that he can bring the cover within reach. Then he's got to lift off the cover and find the toy. And we've looked at the effects of providing these long-chain polyunsaturated fats to infants. So in this study, half of the group had a formula with no LCPs, the other group had a formula with both ARA and DHA, and this is an infant tested at 9 months on this two-step problem. So first you have to get the toy back, that's the tricky thing. Then we put it on the cloth, it's covered, and this is what she does. And that is impressive problem solving at 9 months. Here's another little boy, pulls the cloth, gets the cover, doesn't want the cover, he throws it away. He's after the toy. Okay? Now that's focused attention. These children are focused on getting the toy, not playing with the cloths. And they're thinking, they're planning ahead, they're working out how to solve the problem. They know exactly how to do it. And that is the effect of long-chain polyunsaturated fats. And in fact, it's DHA that's producing this development. Now here's a baby who, same age, he's interested, but he's in the control group. He didn't get the LCPs in the formula, and we take the toy from him, and he's telling me he wants it. You can see, he's watching, he's very attentive, he starts really well. And then see what happens. And all he's got to do is lift off the cover. We know he can do that, but it's gone. And we think that's a problem of working memory. He started out with a plan, he knew what he was going to do, and then it went. He forgot. And that is the effect of not getting LCPs at this critical period of brain development. And it's development of frontal cortex, which is supporting this ability to solve problems in this way. So it's slower. The development is slower in the children who don't get the LCPs at the critical time. Interestingly, the problem you've seen here of working memory, it's a problem in the young. It's also a problem in old age. Frontal cortex is one of the first areas to show a decline, and I'm sure a lot of people here have had that experience of walking into a room and then thinking, why am I here? What am I doing? It's exactly the same problem that you've got with this 9-month-old baby. And we think the reason is the same. It's a problem with the functioning of the frontal cortex. Now this test we've developed has been used in many studies. This is one of them, which was carried out in the USA. Mothers during pregnancy were given a supplement of DHA. It was just over 200 milligrams per day throughout pregnancy. The babies were tested on this two-step problem at 9 months, and the infants whose mothers were given the DHA supplement performed much better. They showed more of these clear, deliberate solutions than the group whose mothers received the placebo, no DHA. So we've got clear effects here. And also in our research, we looked at a more complex problem at 10 months. So we really make these guys work for their toys in Dundee. We've put a block of foam between the baby and the cloth. So to get the toy back, what he's got to do is he's got to remove the block to get the cloth, pull the cloth to get the cover, lift off the cover to find the toy. He's got to plan ahead, he's got to remember all this, and he's got to avoid getting distracted by all these things he's handling. So here's a little girl, 10 months, and she's in the group who received the DHA and ARA, and this is how she... And it's the toy she's after, she's not after anything else. Do it again, we do this several times to see that everything is not just a one-off. It's a toy, as you can see, and she gets it. to really focus, deliberate problem solving. Okay, now here's a baby in the control group. Didn't receive the LCPs in formula, and she's interested. She's looking very carefully. She starts well, and then she got distracted. Memory let her down. This is the difference between getting LCPs at a critical time of development and not. She doesn't solve the problem. That's typical of the children in this study. So this kind of problem solving clearly involves planning ahead. It clearly involves working memory, remembering what you're going to do, and it involves control of attention, not getting distracted by all these other things, focusing on the goal, the toy that the baby wants to retrieve. All of these abilities are controlled by frontal cortex, and we know frontal cortex is developing rapidly after 6 months, and the development is affected by an adequate supply of DHA. So babies who are getting an adequate supply will develop in a normal way. And our new research tells us there are long-term effects on the development of function of frontal cortex, of getting the right amount of DHA in infancy. This is a study we published 2 years ago. We followed up a large group of children, in fact this was with colleagues in Europe as well, at 6 years of age. And at 6 years of age, we gave them a test, which is a measure of ability to control attention. It's a measure of the functioning of frontal cortex. So here's the task. The child sees this picture at the top, and then has to find which of these 4 exactly matches it. It's a tough problem. It's early in the morning. Okay. That's the correct answer. Did you get that? Yeah, it's a really tricky problem. We have 2 measures. The measure is how many out of a series of these problems do the kids get correct, and also how fast are they at pointing to one of the alternatives. Now, children with problems controlling attention, like ADHD, make a lot of errors and are very fast. So they're very impulsive. They point to something, but often they get the wrong answer. What we found was, when we followed up with children, there was no difference in their accuracy. They made the same number of errors, they got the same number correct, but the group that had had the LCPs as infants 6 years earlier were faster. They were 20% faster. And at a time when these kids are learning to read, doing complicated things in school, being a little bit more efficient is clearly going to be a benefit. Also, we have a study, it's a colleague in the US. Mothers were supplemented with DHA while they were breastfeeding. Children were tested at 6 years of age. Here again, they have to find all the examples of this picture on the sheet and mark them with a pencil. They have to do it in a short time. And the children whose mothers were given DHA were faster. Okay? It's not a huge difference, but they were faster, and they scored better on this test. So providing DHA to breastfeeding mums can improve development at 6 years of age. And in another study, a really important study published by other colleagues of mine in the USA, there were 4 groups of infants. One group had a formula with no LCPs. There were 3 other groups. They all had the same amount of ARA, but differing amounts of DHA. This is the average human milk level. This is twice that amount. This is 3 times that amount. And then the children were followed up at between 3 and 5 years of age, and also at 6. This is one of the tests. It's a test of attention control. So you show the child this card here, and you say, whenever you see this, say day. And you show them the card on the right, and whenever you see this, say night. You see the problem. The picture says one thing, you've got to ignore it. It's a really good test of attention control. You've got to remember what you've been told. You give the child a short set of these cards, and you give them, you say, what do you say here? What do you say here? These are the results, and these results are very impressive. So averaging across the 3 to 5 year old age range. This is the control group that didn't receive any LCPs. They get the lowest score. The group that received the average amount of DHA are the same. There's no difference. But the other two groups are doing better. Okay, they're better able to give correct answers on this test, which is widely used as a measure of attention control in children in this age range. So again, we've got evidence that providing DHA at an optimal amount in infancy has a long-term effect on development and development of attention. And equally, we have similar effects for vocabulary at 5 years. Here you can see the control group. These are the other three groups. The groups that receive the LCPs, especially DHA, have better vocabulary development. So these are really important results, new results showing long-term benefits. What about older children? What about toddlers? What about children who are just starting in school? If you go on the internet, you will find manufacturers of food supplements making all sorts of claims, especially for the benefits of providing omega-3. And there's a whole range of supplements. In fact, this has been taken off the market now, but there was a milk with added omega-3. There's all these sorts of supplements that you can give to toddlers and school-age children. Are they a benefit? The answer is, for normal healthy children, there is no evidence whatsoever that providing omega-3 in children's diet will improve their mental abilities, their attention. We don't have that evidence yet. A lot of studies have been done, there's a whole bunch of them here, no effects whatsoever. Some studies have found a few effects, but overall, this very recent review concluded there were no apparent consistent results among the studies with regard to treatment effects. So all these claims made by manufacturers that providing omega-3 supplements for your child is going to be beneficial, you have to be very, very careful. The evidence isn't there for normal healthy children. It may be because we're not doing the studies correctly. We maybe haven't provided enough omega-3 or for a sufficiently long time. But we do know that if you provide omega-3 to children, specific groups of children, particularly children with learning difficulties, the results are very different. Now the results are clear. So children with reading problems, especially dyslexia, and children with ADHD, we know they have lower levels of DHA, omega-3 fats, in their blood. And it's not down to diet. We don't know exactly what the reason is, but the levels are lower. And the evidence does say if you provide a supplement, you can improve reading, you can improve their symptoms of ADHD. This is a very large study, a very impressive study carried out in the UK, published 3 years ago. And they gave a group of children who had reading problems. They were in the lowest 30% of reading. So not average readers, they're poor readers. Overall, the group that had the supplement did a little bit better, but it wasn't a statistically significant difference. When they looked at the weakest readers, the lowest 20% and the lowest 10%, and there are large numbers of children, they got very clear differences. Children with reading problems benefit from getting omega-3 supplements. So these results, we think, are very clear. But normal, healthy, average children, no, we don't have that evidence at all. What about children with ADHD? The evidence is very similar. Small effects, but positive effects. Two very large reviews of all the research conclude that omega-3 fatty acid supplementation demonstrates a small but significant effect in improving ADHD symptoms, but it's modest compared to standard drug treatments, for example, Ritalin, and it shouldn't be used as a substitute for drug treatments. This review here concluded fatty acid supplementation produced small but significant reductions in ADHD symptoms. So there are benefits, we solve the problems, but there clearly are improvements for children with learning difficulties. What about removing substances from diet? One concern has been the inclusion of food colorings and the effects on behavior. The research is very clear. Adding artificial food colorings causes problems with behavior, particularly impulsive behavior, ADHD-like symptoms. There's been a massive increase in the amount of food colorings, artificial colorings, that children are consuming. These are data from the US. This is 1950. This is 2010, a six-fold increase. And if these substances are a problem, then we would expect there to be associated behavioral problems. Research is really clear. This is the gold standard study from the UK. Large number of 3-year-olds, half of them given a drink containing 20 milligrams of food colorings, half given a placebo for 4 weeks, and the results showed very clear effects on ADHD-like symptoms, attention control, impulsiveness. So the observed effect of food additives and colorings on hyperactivity in this community sample is substantial. This was the conclusions of the authors. And these were just normal kids. These were not kids with diagnosed ADHD. And they point out that there's a general adverse effect of artificial food coloring and benzoate preservatives on the behavior of 3-year-old children. Other studies have looked at the benefits of removing artificial colorings from diet, and this recent review looks at all of the studies which show effects. So if this square box here is on the left of this line, it means, in fact, the control group did better than the group that had the colorings removed. But if it's on the right-hand side, then removing the colorings improved symptoms, and overall there is a modest but significant effect. And they concluded that artificial food color exclusion had a statistically significant but modest effect on ADHD symptoms. So clearly the evidence is there that removing food colorings is a benefit. But finally, what about behavior? Antisocial behavior, behavioral problems, impulsive behavior, aggression, and so on. This is the classic study. This is the Aylesbury Young Offenders Unit. And just over 10 years ago, there was a study published which was carried out in the Aylesbury Young Offenders Unit in the UK. This is a quote from Leanne Morgan, one of the induction officers. And she says, it's quietened down over the last year or so, but the violent incidents that do take place are very, very serious now. A lot of weapons are used, pool cue around your head, a prison-made weapon in your throat, in your chest, in your head, in your forehead. There are big problems in this institution. Now, there's a whole range of reasons why these young offenders are violent. Could it be down to diet? The study, which looked at the effects of diet, analysed the food nutritional content of the food available in the canteen. And their conclusion was it was adequate. It met all nutritional requirements. But there's a problem, because the young offenders are allowed to choose which foods they're going to eat. And when that analysis was done on an individual basis, what they found was most micronutrients these prisoners were deficient in, except for one, and it was sodium. So there is a big problem here. The diet available is adequate, but the diet they're consuming is not. Could that contribute to the violence that is occurring in this institution? So the study involved providing half of the prisoners who took part, who were described by the warden as spirited lads, I'm sure you'll agree. Half of them received a supplement of vitamins, minerals, fatty acids, including omega-3 fats, for 4.5 months. The other half received a placebo with none of these additional nutrients. The results were striking and very clear. In fact, they emerged after 3 months. The supplement reduced the incidence of antisocial offences by 26% compared to the placebo group. The group receiving the supplement, it went down by 35%. And in fact, it also went down in the placebo group. And the reason, of course, is obvious. If there are fewer violent attacks from the group receiving the supplement, then there are fewer retaliatory attacks from the placebo group. Very, very strong effects. And the authors conclude that antisocial behavior in prisons, including violence, are reduced by vitamins, minerals, and essential fatty acids, with similar implications for those eating poor diets in the community. Now, these results have been replicated recently. A very large study, very well-designed study carried out in the Netherlands showed exactly the same effect. So this is before the study starts. This is the group that's going to receive supplements, and in fact they're producing slightly more violent incidents than the control group, although it's not a statistical difference. But after supplements, you can see the number has come down substantially. And if you take away all those incidents involving alcohol and drugs, it's still there. That effect is still there. So very nice to see these important results replicated. Now these are young offenders. They're aged between about 18 and 26. What about children? A study just published a couple of months ago shows very clearly omega-3 fat supplementation can reduce aggressive behavior in children aged between 8 and 16 years of age. This was carried out in Mauritius. It's a big ongoing study looking at the effects of diet and nutrition on a population. And half of these children received a gram of omega-3 fats per day. So it's a drink containing DHA and EPA, it's another omega-3 fat. Half received the placebo. Study lasted for 6 months, and the measure was a parental checklist of antisocial and aggressive behavior. Now the parents didn't know which group the children were in. That was kept secret from them. The children didn't know, but the reports from the questionnaires showed a massive reduction in aggressive behavior in the group that received the omega-3 fats, 42%. And that effect lasted at least for 6 months after the trial finished. So it's not just while they're receiving the omega-3, it persists. It shows a long-term effect. The other interesting finding, rather like the study in Aylesbury, was that aggression in the parents was also reduced. So having children who are getting calmed down will also calm down and reduce the incidence of violence from parents. And this down to a very simple dietary intervention. It's not the whole story, but it's contributing to reduction of symptoms. So, to conclude, I think the evidence shows very clearly, if we look at this early period of development, infants need DHA in their milk, they need it in formula, they need it in breast milk. And long-chain polyunsaturated fats, especially DHA, will improve cognitive mental development in infants. And the exciting new evidence that's just coming out shows there are long-term effects. It doesn't just affect development in the first 2 years of life, it affects development 6 years later. Also, the evidence shows that pregnant and breastfeeding mothers need an adequate amount of DHA in their diet. Current recommendations from World Health Organization, from European Food Safety Authority, are at least 200 milligrams per day. But in fact, we're now considering a higher level, more like 400 to 500 milligrams per day. That would be the recommendation. Omega-3 fats do help children with learning difficulties, reading problems, ADHD. The evidence is clear. They're small effects, they're not going to solve the problems, but they are beneficial. And certainly, removing food colorings from diet will also reduce ADHD symptoms. We've got no evidence, really, that omega-3 fats will make healthy school children smarter, but the evidence that is just coming in shows that they will be better behaved and less aggressive, as will their parents. So thank you very much for listening, and I'll be very happy to answer.